And I'd like to begin, I'll mention this again at the end, that this work was funded by the Institute for Global Tobacco Control. And I was challenged many years ago by John Samet when he was here. We had an air pollution group here at the school. We weren't doing much tobacco control, but we were interested in secondhand smoke exposure for our studies on childhood asthma. And at that point, Dr. Samet asked me to kind of develop a secondhand exposure assessment laboratory to support the Institute for Global Tobacco Control. So this has been a long-term kind of collaboration for me, and I'm happy to present some data from the International Hookah Project, some of our hookah research today. And I'll say that some of this data is really hot off the press, so we're analyzing the data as we speak, and we're working on manuscripts. So in some cases, you're the first people to see these data, so I'm excited about that. So for those of you who don't often think about hookahs and water pipes and nargila and shishas, these are terms that have been used around the world. So there's lots of terms for what we refer to what we would call a water pipe, and of course, when I was younger, we called it a bong. Which is not one of these terms, but it's certainly the same concept. So there's hookahs and water pipes have been used in the Middle Eastern countries in particular, for 1,000 years or more, and it goes way back to the beginning of tobacco. So it's very prevalent and culturally very ingrained in the Middle Eastern countries. So we'll talk some about that for the international project. We're going to talk about domestic and international use. But what's unique about it is it uses moist, sweetened, and flavored tobacco. And since it's wet, you can't light it like you can dry tobacco in a cigarette. So as a consequence, it requires charcoal to keep the combustion going. So there's something unique about it already. So it's from cigarette smoke. So it's burning at a lower temperature. You get a different profile of contaminants. And the charcoal has to be used to keep it lit. So the charcoal presents an exposure burden itself. So imagine just drawing air through charcoal all day, whether the tobacco is there or not. That's adding significantly to the pollution burden that you get when you use a water pipe. And so that's what's important, I think, to note right off the bat is that slow combustion in the charcoal adds significantly to what you're breathing. So we see a picture on the side of a couple water pipes if you haven't seen one. So the left-hand side shows the top where there's charcoal sitting on top. So the typical way to do it is there's a bowl. You put the moistened tobacco on it. You put a piece of perforated foil on top of the moistened tobacco. You put the charcoal on the foil. So when you draw the air through the airs get heated by the charcoal as you draw it through, and that's what kind of burns the tobacco for you. And of course, you draw through the water. So the water is kind of interesting because the water does remove some contaminants, but it certainly doesn't clean the air like people might think. So there's a mistaken notion that since you're drawing it through the water that it's clean. Of course, that's not the case, because if it was clean, you wouldn't get a buzz from it, because the nicotine obviously gets through because people still smoke it. So while it does cool the air a little bit, making it a little bit more palatable, maybe you can breathe deeper as a consequence, it's certainly not an effective cleaning device. You talk about any engineer who's going to design an air cleaning device, bubbling water through air would not be an effective way to do that. And so you see on this side, in many settings, this is a very social event way of smoking, because you see one water pipe down at the bottom there with many different tubes coming off it. So it's a way to have an interactive smoking time. So it isn't a solitary experience like a cigarette smoking might be, or tobacco or cigar smoking might be. Somebody up here help me. There we go. So here you see the example of the social event. So it's common in traditional Middle Eastern cultures. You see a bunch of men in this case. Typically that's the case, although nowadays it's not always the case. Sitting around smoking together. They visit at the end of the day. It's a way to interact. So it's common internationally. That's the typical setting. So in the U.S. it's a college bar experience. And that's part of what we'll talk about today. The challenges of tobacco control today is how do we stop this targeting of young kids. Here you see a bunch of young kids around a hookah smoking at the bar. And of course, my first memory, other than the bong, was in a galaxy setting, where here you see in a galaxy far, far away, you actually see Jabba the Hutt smoking a futuristic water pipe there as well. So it's a problem in the past, it's a problem in the present, and we can see from this slide it's going to be a problem going in the future, but hopefully we'll be able to stop that. So there's not good data on hookah water pipe use either in this country or internationally, although people are starting to collect some data. So we know that cigarette smoking rates are declining in the US, but we also know that hookah rates are rising. The data that we have suggests that's the case. So the rise in use is tried to targeting young people. And so I'll tell you a story where my son just moved into an apartment building outside of James Madison University. And it's an apartment complex. And since I pay the rent, I get all their emails. I've since stopped that because it was getting a lot. And so the very first week, I get an email for invitation to the kids to a first social event of the year, and it was a hookah party. Now, this is not university property, but it's university-sanctioned housing, and they have a non-smoking policy. So I call them up and I say, my God, what are you doing? And I get this young woman on the phone who says, it's not cigarette smoking. I say, but you have a non-smoking policy. And she said, hookah's not smoking. I said, well, yes, it is. And your non-smoking policy should apply. And she says, sir, we're not making anybody do it. And so I wrote this big long letter and I got nowhere. But I'm happy to say since then my son said there hasn't been any hookah parties. But there's this massive effort to target young people. Anybody walk around a college campus these days, you'll see this condensation of hookah bars around the college setting. So there's a couple things that get around current tobacco regulations about targeting young people. So years ago, the laws in this country said you can't have flavored cigarettes, for example, and you can't give away free cigarettes. Neither of those laws apply to hookahs. So hookahs are obviously flavored, so they're attracting people who are looking for interesting flavors. And as my son's college experience says, they give it away for free in some cases. So they're trying to hook people young, they're trying to attract young people. There's a reason why there's this high density around colleges. So one of the best surveys I found to date is about water pipe use in California, and it showed that between 2005 and 2008, it increased by 40%. And almost all this increase was due to young adults aged 18 to 24 years of age. So the typical old white male isn't running out to hookah bars. The hookah bar problem in this country is primarily a young person's experience, whereas internationally, it's the old white male experience we saw about before. According to CDC statistics, 21% of high school seniors report using a water pipe in 2013. That's up from 17% in 2009. And estimates used by college students range, depending on the paper you see, from 22 to 40%. And recognizing that only 17% of that same age group smoke cigarettes. So the prevalence of hookah smoking is a lot higher than cigarette smoking. So we have this big challenge, I think, today to think about why cigarette smoking rates are going down, but hookah smoking rates are going up, and how can we combat that? So as I said before, there's this gap in the tobacco control policies. So in Maryland, if your principal income for your venue is tobacco products, you can be exempt from the indoor tobacco control regulations. So the typical hookah bar in Baltimore sells mostly tobacco. They might sell a little bit of food, but not a lot. And there certainly isn't people coming around asking for cash register receipts to document how much receipts they're bringing from tobacco versus food. But they let people bring in their own food, they let people bring in their own tobacco, bring in their own alcohol. So you now have this social venue where people are eating and drinking, and they're allowed to smoke hookahs indoors, and that's, I think, the exemption they get around. So we know that experimental studies suggest that water pipe secondhand smoke contains levels of toxicants that are certainly similar to what cigarette smoking, and that's part of what we're going to do today. But there are very few real-world studies of secondhand water pipe smoke exposure, which started us down this road. So just a little bit about the smoking topography. So there's some studies, some data that are coming out now about what are the characteristics of smoking a cigarette versus smoking a water pipe. So this doesn't apply necessarily to secondhand smoke, but it certainly addresses this issue about is it safer or not. So a cigarette takes about 5 minutes to smoke. There's a number of estimates of how long a typical water pipe session is, but the typical water pipe session, the data suggests it runs from anywhere from 45 minutes to a little bit more than an hour. So you take 5 minutes to smoke a cigarette. When you sit down to smoke a water pipe, you're there for about an hour. So, and the typical water pipe session averages about 200 puffs. And when you look at all this together, a smoker will inhale about 150 times as much smoke during a water pipe session than from a single cigarette. So all the contaminants are in the water pipe. The water doesn't remove 150 times the contaminants from it. So there's a huge smoking burden here that comes from using a water pipe. And it's tied tightly to the fact that when people use a water pipe, they use it for a long period of time. So if we look at some of the contaminants in a single water pipe session compared to a single cigarette section, there's about 3 times as much nicotine you get. There's about 145 times as much carbon monoxide. And the carbon monoxide is coming, that increase is coming from the charcoal. The charcoal is a prodigious producer of carbon monoxide because charcoal is a slow combustion process. You remember reading the paper every year in this country, there's people who die from carbon monoxide poisoning because they bring charcoal grills inside their houses and they forget and they go to bed and the charcoal is just smoldering in their kitchen and they overcome by that. The tar is about 800 times the typical, about 36 times the typical cigarette smoking session. So even though the water is there, we see that we got a lot more nicotine, we got a lot more carbon monoxide, and a lot more tar in a single session. So this notion that they're safe is something that we need to combat. Now, that wasn't the focus of what we did. We were looking more at the air quality in these hookah bars and what that might mean for non-smoking employees or non-smoking patrons. And so the first thing we started in order to pilot test our ideas, we did a study here in Baltimore. So we had the Baltimore Hookah Study, we call it. And I'm going to move back and forth in this talk between hookahs and water pipe because people call them the same thing. The terms are kind of interchangeable, and I'll use them interchangeable throughout this talk. So in our Baltimore Hookah Study, we looked at the airborne carbon monoxide, the particulate matter, and we looked at the fine particulate matter, PM2.5 we call it. And that just refers to the size of particles that we include in our measurement. And whenever you burn something, it produces mostly fine particles. So when we talk about fine particles, we're really talking about the combustion particles that are produced during the hookah smoking process. And we measure nicotine in the air as a marker of directly of the tobacco that's used in the environments. So the purpose of the study was to evaluate our sampling methods to employ in a larger international study, which I'll talk about later on in this presentation. This is not a very effective way to advance the slides. So we identified hookah venues in Baltimore through web searches and word of mouth. And it's like vaping right now. If you drive up a road, you'll see a vape lounge. You might drive back 2 weeks later and the vaping lounge is gone. So these hookah bars actually kind of came and went over the course of our study. We would identify one, we'd go to sample at it, and it would be gone. And others would come up during that period of time as well. So it's not a very stable business in the first part. So the sampling was conducted, I call it commando sampling, but probably the better way is clandestinely. So we didn't ask permission. So we went in as patrons, and we carried our sampling equipment in there, and we kept it discreet, and we didn't disclose what we were doing. And so we disguised the sampling equipment in backpacks when we went into these bars. I didn't go, but I think there was one of our staff was a smoker who participated, at least one staff member. So as part of the study, 7 hookah cafes were surveyed, and 2 were visited twice. We want to look at just how variable it was. And sampling occurred between December 2011, August 2012. And we went on during peak occupancy times, typically Friday, Saturday night, between 10 o'clock and 2 o'clock in the morning. We did air sampling, and we also measured fixed venue characteristics like the size of the venue, how many doors were open, was there cooking going on, how many people were smoking, and observations of that like. And here's some data. So if I could just set up the plot, because we're going to see graphs a lot like this throughout. So at the bottom we have the venue, and some of the venues, you see venue 3, A and B, that's the 2 times we sampled. Here is the particle size, the PM2.5 particle concentration, and we have a box plot of the particle concentration. I'll talk more about the methods we use when we get into the international study. But the box plot of the particle concentrations during that 2 to 4 hours evening session. So you see there's a lot of variability across venues. Some venues were quite high, so this is 2,000 micrograms per cubic meter. So just to give you a sense for what is high. So a really bad day in Baltimore for ambient air pollution is between 100 and 200 micrograms per cubic meter. That's a bad air pollution day. The Occupational Safety and Health Administration says if this was a coal mine, for example, it would be about 5,000 micrograms per cubic meter would be unacceptable if this was like a workplace. So we're talking about concentrations that are approaching occupational settings that we see in dusty trades. And so we see that there's a lot of variability, and the line at the bottom represents the WHO 24-hour guideline that they suggest for indoor air pollution at 25 micrograms per cubic meter. So we see that we're well above that. we see that there's a lot of variability. We see in some cases we're approaching occupational exposure limits. And even if we look at the same venue, there could be tremendous variability from day to day, depending on the characteristics of the venue that night, how many doors are open, how many people are present, and so forth. So overall, the mean particle concentration, fine particles, was about 700 times higher, was 700 micrograms per cubic meter. It greatly exceeded the WHO guideline. In 2 of the venues, the PM concentration was 1.5 micrograms per cubic meter, which is roughly about half what we'd expect for the occupational concentrations. And we also note that these concentrations exceeded those typically measured in hospitality venues that allow cigarette smoking. And we'll present some of that data later. So in terms of carbon monoxide, we see very similar pictures. So we have the carbon monoxide concentration in parts per million. We have venue here, and we have box plots, and we have the WHO guideline. This is for 1 hour WHO guideline. We see it's a little bit more than 20 parts per million. And so the carbon monoxide concentrations were lower than the PM concentration. So this, since it's a slow, smoldering combustion, it's a prodigious producer of particulate matter. And so we expected to see higher values. Carbon monoxide is actually a little bit more problematic to measure than the particulate matter, and we had some problem with some of the instrumentation, so we actually have less data. But we still see in some cases we have very high carbon monoxide concentrations produced. We're not in any situation where we might be approaching something that might be dangerous to life and health, like you might get if you bring your charcoal stove into your kitchen at night, but certainly these are things we have to worry about. So overall, we concluded that the indoor concentrations of PM and CO greatly exceeded the health-based exposure standard guidelines, and we also noted that PM 2.5 and CO were markedly greater than venues that allowed cigarette smoking. So this set the stage now for the international hookah study, but we published the results of this paper in a journal, and it came out, and we highlighted it was done in Baltimore, Maryland. And we received calls from a couple of county executives about regulating, since all these venues were in Baltimore County, about regulating hookah cafes in Baltimore County. And I'm happy to say they're still working on it. They haven't gone any further with it, but they're thinking about it. So the International Hookah Project was a cross-sectional survey of water pipes, venues, and employees. So the Baltimore one was just air quality, and it was done clandestinely. So the International Hookah Project, we didn't think we could come in commando. And so we had to identify venues, and we wanted to consent employees to participate in the study as well. And so the project was funded by the Bloomberg component of the IGTC funding here at the school. And we went to Istanbul, Turkey, Moscow, Russia, and actually, since we had this slide made, we've been to Cairo, Egypt as well. So it's interesting that each of these countries was pretty stable before we went, but either right before or right after we went, things kind of got politically a little dicey. So it was a bit of a challenge in some of these cases, but we managed. And so the flow chart you see below is that we were identified the country, we selected venues, and once we had the venues selected, we went in and we made observations. We had questionnaires where we asked about the venue. We did air sampling. We identified employees. We measured the biomarkers, and we also asked them about their smoking history. So we have data now. I think the first big study of these type of environments, we actually have data on individual employees and their smoking history as well to compare the results to. There's a few studies that have been published, like our previous Baltimore study, look at air quality, but this is the first one. There's actually been one study that had a small amount of data. The first big one, comprehensive study, looking at the biomarkers in employees. So this slide shows you the types of samples we collected in terms of air samples and biomarkers of exposure. So we measured nicotine in the air, and we measured nicotine in hair and cotinine in urine and saliva as markers of how much nicotine you took up. So nicotine is the common marker we measure for smoking-related pollutants because it's the only thing that produces nicotine is tobacco in the air. We measured nicotine-derived nitrosamine, NNK, so this is one of the tobacco-specific nitrosamines, so we're interested in how much of that gets in the air. And we wanted to look at how much of the metabolite, principal metabolite of this nitrosamine, NNAL, in urine. We want to measure carbon monoxide, and the corresponding biomarker for carbon monoxide is CO and exhale breath. We measured particulate matter. There's no real biomarker for particulate matter. but we measured polyaromatic hydrocarbons. So this is a concern that in hookah bars, particularly because they use charcoal. Charcoal produces polyaromatic hydrocarbons. A number of them are carcinogenic. And we had the corresponding 1-hydroxypyrene in urine as a biomarker. So we try to pair the air sample and the biomonitoring so we get side-by-side measurements across the air pollution in the venues and in the employees themselves. So in terms of methods, for particulate matter, we had an indirect measure of particulate matter. This is the device we used. It's called the PDR 1200. I could talk more about it if you want, but let's leave it at this for now. It's an indirect measure because it's based on measuring how much light is scattered by the particles. There's a size-selective inlet here, so it only collects particles that are less than PM 2.5, so we know exactly what particles. So if there's some reason somebody sweeping the floor and kicking up a lot of big dust particles, we would exclude those because they wouldn't be interested in them. And in fact, that would do that with this inlet. It's data logging, so we get the concentration as a function of time. We have to measure the temperature and the humidity alongside as well, because we know that this device, since it measures the light scattering of particles, there's a known bias at high humidity. Particles tend to look bigger than they are when it's dry out, and so we have to account for the humidity, so we measure the humidity. Now, we measured nicotine using a passive integrated sampler, traditionally what we've used for decades, and we see a picture of that here. Here's a cartoon of it. There's a picture of it right there. These are not commercially available. We make these in our laboratory. It's based on a device that was originally designed by Kathy Hammond back in the late 1970s, early 1980s, I think. Can't remember the exact date. But it's a widely used method for secondhand smoke exposure studies. It's a passive sampler, so it only gives you the average value over the length of time that you place it in the environment. All right, so it doesn't give you real-time data, but it is easy to deploy and is kind of foolproof, since all you have to do is take the cap off and put the cap back on. So carbon monoxide, we used a direct reading instrument for carbon monoxide that has an electrochemical sensor, and this is a picture of that. So this is about the size of a Sharpie, a big Sharpie. So this is a pretty small device. The challenge with this device is it has to be factory calibrated or laboratory calibrated. We were able to do that here, so we would calibrate it before we sent it overseas, but we wouldn't calibrate it again until we got it back from overseas. Typically, if we did it here, we'd calibrate it every time before it goes in and out of the field, but we can't ship calibration gas around the world. So one of the limitations was that it wasn't calibrated as often as we'd like. The polyaromatic hydrocarbons we measured using a direct instrument. This is the PAS. It's a particle-bound pH, so it only measures those. pHs can be semi-volatile and non-volatile. And the non-volatile pHs they don't evaporate, so they stick to particles. And so this measures the particle-bound component, and it uses it by measuring ultraviolet absorption. So PAHs, because of the complex structure, absorb ultraviolet light. So if you shine ultraviolet light at it, there's a certain amount that's going to be absorbed, and that absorption is going to be dependent on the amount of PAHs on those particles. So it's not a commonly used piece of instrument, but it's a growingly used piece of instrument. So we deployed it in these bars, and so this is about the size of I know it's about 6 inches by 6 inches. So none of this can be easily kind of snuck into a venue. In addition, we can't clandestinely collect somebody's hair, for example. So this is an example of the kind of data we get for carbon monoxide and particulate matter. This is corrected and over time. So you see we can get the nice profile of how things vary over time. And what we try to do, this is peak time, so we'd place these in a venue for 24 hours, and we'd identify what we think is an evening peak time, and we'd extract the data from that evening peak time. So we want to know what the concentration is when the venue is used at its greatest. So we weren't interested in the middle of the night when nobody was in the venue. We might not be interested in early in the morning when nobody was in the venue. So just to be consistent, we tried to pick what we consider these peak evening times in all the venues that we sampled. And we extracted the corresponding carbon monoxide and particulate matter data, and that's what we summarized in our statistics. So here we see some slides of, so since this was an international operation, we had to identify a collaborator in each of these countries. We had to identify field staff in each of these countries. We had to ship the equipment to each country. We had to train the people in each country. So there's a lot of logistics to doing this. Sometimes it works well, sometimes it doesn't work as well as you'd like. But here you see a training in Russia, and Christy Torrey was one of our laboratory staff doing the training, and here you see she's giving a lecture and she's showing the equipment, and here's a more intimate demonstration of how the equipment is used. So we relied on this week-long training experience. We typically do a practice venue at each country, and then we'd be available throughout the course of the study to make sure if there's any questions. But sometimes people say, it doesn't turn on, the pump stopped working, I can't download the data. So there's constant contact back and forth to these countries. And for the most part, it was pretty successful. Obviously, it would have been better if we could have deployed our own staff. So here's just a few pictures of some of the venues. So here's a venue in Istanbul, Turkey. You see the water pipes lined up here. So this gives you a sense for just how the high volume of smoking goes on in these venues when they have this much stuff assembled, ready to go. And here you see a picture of a typical seating area with the water pipe in the middle there, right there. And everybody can sit around that and visit. So I have a few more pictures to show you. So these are from Egypt. So Egypt is a much more equatorial type climate. It's a warmer climate, so a lot more outdoor activity. So here you see the water pipes lined up, ready to be deployed. So hundreds of these things at a typical venue. So that's how much they're being used. And here you see back where people are preparing, and this is what it looks like back where people are preparing so we see the bowls there with the charcoal and stuff ready to go. So they're constantly lighting things. So one of the jobs of people in these venues is to keep the charcoal lit. And so when you're sitting there, they don't want your water pipe. You don't smoke till it's gone out. You sit there as long as you want to sit there, and they'll keep the tobacco filled. They'll keep the charcoal going for you the whole time. And so one person's job is to go through and make sure that it doesn't look good, or you're not doing your job if you're owner of one of these venues if you let the charcoal go out, for example, so they can't smoke. They got to ask for more charcoal. So there's somebody whose job in many of these venues, his job is just a lighter who goes around and makes that happen. So it's one of the things that contribute to the exposure, because it's not like a cigarette. When it's done, you're gone, and maybe you might not pick up another cigarette for a half hour, an hour or so. This one, you sit there, and as long as you're sitting there, that smoke will be available to you. And here we see a picture of people smoking outdoors. So one of the challenges doing the sampling was, in many cases, obviously things will be higher indoors, but we want to assess what's happening in these peri-outdoor settings. So you're not really indoors, not really outdoors. And so it's a challenge to think about where we put the sampling equipment. What does it mean to be indoors and outdoors in these venues that have one whole wall that might be open to the outside? So these are some of the things we had to deal with in terms of designing our sampling strategy. So here you see one of those lighters. He's blowing on the charcoal there, getting it lit. Here you see in the back where they keep the charcoal ready to go. So if the charcoal goes out, they don't have to always light it like this, but they can bring it out lit to put in your pipe. And I couldn't find a good picture of the equipment deployed in the field, but here we see some of the field staff walking out. We put all the equipment in a backpack, and this was in Turkey, and this is what they deploy into the countries. Now, this creates a problem because some of these countries, putting a piece of equipment, a backpack in a public place with electronic noise, creates some problems. So we had to make sure that the staff at the venue was comfortable with this, that they placed in a position where the customers aren't going to get unnerved about it. And so there's a lot of challenges about doing this. Okay. So here's some data. So this is a big, complex picture. You don't get lost in too much of the detail. But so this is Turkey, Russia, and Egypt, and this is the fine particle by venue. So each box plot is a venue in each country, and here's the particle concentration. And I put a couple lines in here just to show you just help you see where things sit. So this is that same WHO 24-hour standard there. So we see almost everything, all the measurements, the vast majority of the data is well above that WHO 24-hour measurement. And here's the median level for the Baltimore Hookah study. So things are a little bit lower across the board than the median for the Baltimore Hookah study. But many of these venues, except for Russia, which is here, which tends to be a little bit higher, like I say, have this kind of indoor-outdoor kind of problem. Certainly in Istanbul, a lot of these venues, the smoking was indoors-outdoor, and Egypt was indoors-outdoors. So it suggests that the exposures are actually a little bit higher in the U.S. than some of these international studies, but they're still extremely high when we consider the health-based standards. So we look at carbon monoxide by venue. We see a similar picture we saw before. So carbon monoxide levels aren't as remarkable as we thought. And we see the box plot by country. So we have less data for carbon monoxide because the equipment was more finicky, and a lot of times the data wouldn't download right, and you know, in the hands of people who really weren't trained to use it on a day-to-day basis, we had some data loss as a consequence of that. So this red line is the EPA 8-hour standard, and it's also the median of the Baltimore Hookah study, so which was about 9 parts per million. So these are on a log scale, if you didn't notice that. And so you see most of the data are below what the EPA suggests for an 8-hour outdoor standard is. So the carbon monoxide isn't as remarkable as I expected, at least as an ambient air pollution, as an indoor air pollution problem. But certainly the people smoking the hookah are drawing through the charcoal themselves. I think their carbon monoxide burden is probably more significant than the ambient outdoor measurements we get in the bars might suggest. So the PAH is by venue. So this is the PAH concentration, polyaromatic hydrocarbon, nanograms per cubic meter. Again, on a log scale by venue, and by 3 countries, by Turkey, by Russia, and Egypt. And there's no standard for this type of measurement. This is a pretty unique kind of measurement. There's not actually a lot of data with this piece of equipment. This piece of equipment is relatively new. And in fact, we have very little, not as much data in Turkey because the company couldn't even make the equipment available to us until we were halfway done with Turkey. But you see, nonetheless, so we've used this equipment here on the Monument Street parking garage. We're interested in what the exposures for pH measurements in an urban environment with a lot of traffic, just to give you kind of a background measurement. And so this is the Monument Street parking garage. We published a paper a few years ago using this piece of equipment. So we see the pHs are in Egypt, and in Russia we have some data, maybe not as much in Turkey, but I'm not so certain about these data because we didn't get a full picture of Turkey. But it's certainly higher than what we get in an ambient environment. And this is clearly, I think, a signal from the charcoal that's producing this high PAH signal as well. So the nicotine only gives us 1 measure per venue, if you remember, so it's an integrated sample. And so if we look at the distribution of nicotine concentrations by study site, and here we have the median and interquartile range, and so in this purple line represents the smoking venues that we measured in the international bar study as a comparison. So these are bars that allow cigarette smoking, so it's not hookah parking. So we see in many cases the nicotine exposure, indoor air quality, is higher or equal to what the international bar study suggested. So this is overall, so certainly, even though it goes through water, the nicotine in the ambient air is not diminished. So I'm not as worried about the nicotine as a direct toxicant as an air pollutant as I am. This is a good marker of how much smoking is going on.
Do you think some of the venues weren't using tobacco? Like sometimes hookah bars, especially in North America, they say it's not tobacco, it's other things, which obviously would affect the nicotine concentration.
So it's possible, but you know, internationally, I don't think that's as much as it is. And I know, for example, in New York City, where hookah bars are outlawed if they burn tobacco. There was a recent survey published in New York City. They went to hookah bars, which aren't allowed to measure tobacco, and we measured nicotine for them in that study. And almost every bar we measured, there was nicotine in that air. So they were clearly, they had the non-tobacco stuff there in case a regulator came in, but they were smoking tobacco in those venues. So even if they say that's not the case, it's probably the case. So now if we look at the NNK, so NNK is the tobacco-specific nitrosamine that we measure in the air. So this is the carcinogen that people think, or a marker for the carcinogens that people think make tobacco smoking so bad. And here we see the median is right about 1 nanogram per cubic meter. Now there's not a lot of data on this indoor air quality stuff. So on NNK in indoor air environments, we're one of the few studies that ever measured it, certainly in water pipe cafes. So I don't have a reference value here, but if we looked at a few laboratory studies that measured NNK in the air from cigarette smoking, it ranged from anywhere from about 0.5 up to about 9. So the tobacco-specific nitrosamines are certainly within the range of measurements that people reported. The few studies that measure this in cigarette smoking venues. So there certainly isn't an attenuation of these tobacco-specific nitrosamines as a consequence of drawing them through the water. Now if we switch to the biomarker, so that's the air pollution mixture we looked about. So if I'm going to report some of the biomonitoring data, we have other data presented, but to save time, I wanted to focus on a few things. So here we see Russia and Turkey. So we don't have any biomonitoring data from Egypt yet, because Egypt won't ship our samples out of the country. So one of the consequences, I think, of the political disarray in Egypt right now is that we can't get permission to get our samples back. So we've collected a lot of samples on biological samples in Egypt, and we're still struggling to get them back. So I won't show any biomonitoring data from Egypt, but from Turkey and Russia, the presentation will be the same, where this is the concentration in whatever biomonitoring option we have. And here we broke it down into people who say they're currently smoking, people say they're former smokers, and people say they never smoked. And so if we just look at hair nicotine, so nicotine gets taken up by your hair as it grows, and your hair grows about 1 centimeter a month, and we measure 3 centimeters of hair. So this is an average nicotine uptake over about a 3-month period. So it's a nice long-term biomarker. And we see that, as expected, the hair in the smokers is highest. The people who are former smokers is lowest, and the people are intermediate, and the people say they're never smokers are lowest. And now we see that there's a lot of overlap between the former smokers and the current smokers, and this is relying on self-report here, so it's likely that some people say they're former smokers might actually be current smokers, but all these people are exposed secondhand smoke by virtue of working in these hookah bars. And so what we see is this purple line here is the hair nicotine concentrations in non-smoking employees in the bar study that Anna Navas is the PI on. So this is an international bar study. We collected hair, very similar study. So these are studies, bars that allow cigarette smoking. So we see certainly that the non-smoking hookah employees in Turkey are right in line with what we saw for the non-smoking employees in bar studies around the world. So there's a secondhand smoke exposure burden here that's undeniable in terms of if you're a non-smoker. That's an important case to be made. Now, if we look at so this is actually the non-smokers here in the never smokers in Turkey, and these are the former smokers. So these two groups are reported themselves as being non-smoker currently. So I think we're documenting very clearly that there's a secondhand smoke exposure burden here that's by virtue of the fact that you're just breathing the air in these hookah venues.
Who would a non-smoker, non-attendee hookah bar sit on that?
We did these are all employees. So you're asking about.
So I just want to know where a normal would sit.
So I think you'd be right about here. So these are non-smoking employees, and these are just non-smoking people. So this is a big study around the world. So I think.
A non-smoker who does not work.
Oh, Anna, do you know that question? So just if you think about the NHANES data, the background.
Probably like if you go to the smoke-free venues only in the raw study, it was like the purple line, it would be like 3 times lower on that purple line.
So it'd be down about here.
Like there. And there you would have people who live with smokers and things like that. So it's really hard to get people who are not exposed to tobacco smoke, especially internationally, because there's so much smoking everywhere.
So if we look at the 1-OHPG, so this is the marker of pH. So this is the hydroxypyrene. So this is the biomarker. This is the excretion product of pyrene, which is one of the PAHs that we measure in the air. And again, we don't have any good benchmark data, but we see something interesting here that if we remember the different side, there's this nice ordering between smokers, former smokers, non-smokers. We lose that here. And I think because the PAHs are so high because of this dirty charcoal that's being used that we really lose this segregation. So we see in Russia, for example, the pH levels are indistinguishable whether you're a current smoker, whether you're a former smoker, or whether you're a never smoker. So this is pretty interesting. It suggests that there's such high levels of PAHs that everybody's being overexposed. And we don't see it as clearly here, but certainly the levels of PAHs in the non-smokers and former smokers are on par with what we see in Russia, but the smoking, current smokers, it's much higher there. And that could be differences in smoking patterns and use patterns. But again, we see this very clear picture of this important carcinogen byproduct. We measured it in the air, we measured it in the urine. So we have this nice picture between what we measure in the air and what the biological consequences of having worked in that environment are. in both smoking, former smoking, and never smoking employees. So now if we look at the urinary product of the NNK, which is a tobacco-specific nitrosamine, and when it gets ingested into your body, it gets metabolized into a variety of things, but the principal metabolite is NNAL. It's got a big, long chemical name. And we see that, and this is presented in terms of the urine NNAL is standardized per milligram of creatinine, so we correct for void volume. And again, we see the similar presentation where we have current smokers, former smokers, and never smokers. We see this nice degradation, this nice function that we saw before. Again, we see it in Russia, maybe a little bit steeper in Turkey, but we're still seeing elevated levels in non-smokers. And there isn't, again, a lot of data on this type of information, so we're searching for benchmarks to put it on. But I think we're documenting very clearly that these tobacco-specific nitrosamines are in the air, and the tobacco-specific nitrosamines are being ingested by non-smokers, and these two groups, and we're appearing in their urine. So we can make a very strong case that this secondhand exposure route is going to be significant if you're a non-smoker in these environments, whether you're a non-smoking employee or whether you're a non-smoking bystander. So I'd like to wrap up there, leave some time for questions. So that we conclude from this, indoor air quality in hookah water pipe bars is as bad or worse than venues that allow cigarette smoking. So that's an important point to make. Exposure products produce a significant health risk to non-smoking employees and bystanders. So we're able to document the exposure in the air, be able to show what's the biological consequences of that through our biological monitoring program. And this suggests there's really a strong need to address this regulatory gap, both nationally and internationally. I think nationally in this country, I think we have to think very hard about how do we begin to build the case that this targeting of young people by seeking out colleges and putting these things around college bars and communicating to people. We could give a whole other talk, I think, on attitudes and beliefs about hookah smoking, but it's very clear when you look at the literature on attitudes and beliefs that people are being told, the message is being given to them that this is safe, or certainly it's safer than cigarette smoking. And that mistaken impression needs to be combated, and I think there needs to be a strong education campaign to address that. We need to have regulations and stuff that stop this targeting of young people by putting these things in near college campuses as well. So there's a lot of people, and I hope I didn't leave any names out. So Anna Navas and I have collaborated on these studies for years, and so she and I are co-PI on these projects. Joanna Cohen, IGTC, have been very, very strong supporters of this type of research, collaborators on the project, as well as the IGTC providing support. Jolie Susan has been the project coordinator for these studies, been just incredible. You can imagine the work it takes to manage these studies going in 3 different countries, setting up the contracts, dealing with all the communication back and forth. So it's been a huge organizational challenge, and certainly Jolie rose to the task. Paul Strickland was another faculty member who collaborated with us. He helped with the PAH measurements and the interpretation. Catherine Moon is a graduate student helping out the project. Chrissy Torrey worked in my lab. Deanne Williams also helped with the field work, and a number of other people. Hoda Majid, Tim Green, Jackie Ferguson, Zulu Sun, Salin Abu Baker, and Anna Rule are all people who participate in the study. So there's a big effort to go into the data presented today. So I'd like to thank you very much, and I'd like to acknowledge my collaborators, and I'll open the door to questions. Yes?
How do you control for the complexity of the structure of the PAH?
So how did I control for the complexity of the structures of the
What
pH?
I mean to say is that, for instance, dimethylbenzantrazine contains, I don't know, 5 benzo groups. Polypine has, I think, has fewer. And your methodology you're using measures light, I think, right?
So right, so it's a average sort of measure, right? So it's not a perfect measure. So it measures how much UV is absorbed by the particles, and it's a wavelength that targets the complex kind of aromatic absorption that you get from a pH molecule. So it's not a perfect measure. But if we wanted to take an air sample and measure the PAHs using chemical methods, it would cost about $2,000 a sample. So clearly there's some limitations to this method, but it allows us to collect some meaningful data, you know, at a resource that we can afford.
And how do you control for time? For instance, depending on national working patterns, people may congregate in these bars at different times. And how did you control for that? In other words, was it, and I was a little late, so I may have missed the information. I don't know.
So the question is, how did I control for time? Because these different venues, different cultures have different times. So we hired local field staff, and as part of their identifying the venues, they went around. And I skipped over some stuff, but we spent some time with them talking about what a typical venue is, how to characterize a venue. So they visited a venue. Before they did any sampling, they asked the owner of when their hours are, when their peak occupancy times are. And so we're able to target, I think, the sampling based on those sorts of data that we collected, based on that preliminary information with the owner. So all these venues agreed to cooperate, remember. So we had to interview the owner to get their permission, and we were able to ask questions like that. So I think we could make sure that we went to the best possible when we think things were kind of peak normal occupancy.
Bill, you mentioned another difference between some cigarettes that are constantly being recycled. Is there any information, just out of curiosity, about residue in the actual hose and how that affects how much of the water that you're actually inhaling?
I don't know the answer to that. I haven't seen it. So this is not a well-studied problem. So people have been measuring the water to see what's removed, but I don't know of anybody who's measuring kind of what might be residual in the tubes. They do give you a clean mouthpiece every time, obviously for hygiene purposes, but I don't know of any data like that.
I'm wondering if you came across any particular barriers to getting people to want to participate in the study, and how you dealt with those, whether there were particular ways that you convinced people to do the study, or allay any trust, mistrust, or.
So I'm going to make sure if anybody from the current collaborators want to help answer that, because we didn't do the recruiting ourselves. Remember, we relied on the field staff to do the recruiting. But I do remember talking, the biggest barrier was getting the owner to participate. And once the owner participated, I don't think we had any trouble getting employees to participate. And usually there was an incentive, and if one person got it, they all wanted it. And so once we got it, I think the big barrier was getting the owner to participate. And I can't remember the exact number. Can you remember? We had about a 50% participation rate.
The honors, it was lower than.
Lower?
I think it was like 20 or so.
Okay. But it was higher than I expected. In this country, I think we get 0% participation rate. So to participate, one of the things we asked for was we want at least one non-smoking person in the venue to participate, because we're really interested in kind of this comparison of the smokers and non-smokers. And so a lot of times, if you're working in a smoking venue, you're not likely to be a non-smoker. You're more likely to probably be a smoker yourself. So having that, I think, created some problem as well.
Given that hookah smoking is so common around the world, why do you think there haven't been any formal health-related studies looking at smoking?
So the question is, since hookah smoking is so common, why are there no studies of hookah smoking and lung cancer? I'm going to have to speculate for a minute. So one, I think internationally, where it's part of the culture, people have been doing it for large parts of their lives, where a study like that might be easier to do. I think it's probably going to be hard to tease out cigarette smoking and tobacco smoking, so the hookah smoking. So I think there's a lot of overlap internationally between people who smoke cigarettes and people who smoke hookahs. And a lot of these countries, these Middle Eastern countries, are poor countries without a lot of health infrastructure, where cancer registries don't exist. The ability to do a study like that might be tough to do. I'm imagining, a lung cancer study in Egypt. The infrastructure we'd use to have a successful study like that in the U.S. likely doesn't exist in countries like Egypt. So I think there's probably lots of reasons why. But I don't think you need to do a lung cancer study personally. If you're breathing these things and they're the same levels of what people breathe when they smoke cigarettes, there's no reason to expect at the end of the day things will be any different. Now, obviously, it'd be nicer to paint that picture to get the evidence base. You need to kind of drive the regulations. But I think you can do that without having to wait for such a study. So that's a great question, right? So the combustion of the flavoring products is very understood. So sorry, the question is there any research on the flavorings and what it means to burn the flavorings, right? So I don't know the answer to that question because I don't know he's done it. So the flavorings, when they burn, these are complex molecules. It's going to play. So the tobacco combustion product environment from a hookah pipe is going to be drastically different, I think, from a cigarette because of the charcoal and because of the flavorings and because of the lower combustion temperature. Nobody has invested the kind of effort into looking at the range of chemicals in hookah smoke that they have in cigarette smoking, for example. So there's decades of data trying to analyze the 5,000 different chemicals they can measure in cigarette smoking. Nobody has done that to that detail in hookah smoking. And certainly I think there's an opportunity to worry about what these combustion byproducts and some of these complex flavoring molecules are going to be. But I don't think we know the answer. Plus they put other things in there as well, other things other than tobacco, which are going to produce some concern as well that we don't know anything about.
So, related to this question, do you know by chance what is the capacity of the water to retain any one of these compounds? And was it changed? I mean, I don't know anything about hookah smoking. So, did they change the water at the same time, or how did that? You know, because the capacity of the water to retain some of the compounds may differ depending on the time that the water was used.
So the question is there some data on what the capacity of water is to retain compounds, and do we know anything about how often the water has changed? So I don't think that's the issue, right? Because I don't think the water is effective at all. And so certainly the water would have a lot more capacity than if you could somehow, so if you really want to use water as a scrubber, for example, for air pollution, they create a fine mist. They try and create this huge surface area of the water, to the pollutant in order to get it to effectively remove something, if it happens to be water soluble, which many of these things are not. But when it comes to the hookah, you see these large bubbles coming through. So the mass of that, the volume of that bubble relative to the surface area is very small. So the opportunity for things to be removed from the water is pretty trivial. And so something like nicotine, which is water soluble, there's probably some removal, and people have measured nicotine in the water. I don't know what the capacity is to remove the water. I don't think anybody's asked that question. And I don't know if anybody else knows how often they change the water in the water pipes, but sometimes it can look pretty skanky. So suggesting it might have been there for a while. I don't think they let mold grow on the top of it, but I don't think they change it very often.
Question, Pat. And again, this is from the field work, so I don't know if Jolie or others recall hearing from your data collectors whether the employees had any concerns and wanted to know what their biomarker levels were, and were sort of hoping to get some information. Do they have any concerns about their potential exposures?
We did ask questions about the beliefs about the dangers of hookah smoking, but I don't know if anyone actually requested their results. I haven't been asked.
We're creating country-specific fact sheets, which will all go back to all the venues and all the participating workers. And if anybody asks for their data, I think we'd give it to them. But we're committed, I think, to those fact sheets. And we do have all these questions about their knowledge, attitudes, and beliefs, which we haven't really parsed out yet. We want to look at that. But so it'd be interesting to see how their exposure relates to what they think the harm might be or not be.
Do you have any idea of the profile of the clientele on these places? The data? I mean, given that Hookah internationally was considered a no-folks thing, and there's this new attraction to younger people, would you be able to?
So we have a couple opportunities to do that. So the question is, do we know anything about the clientele? And so when we do the employer interview, we ask something about the clientele. So we're trying to get a picture of the profile from there. And we're also there during the evening, and we're making observations about numbers of people. And we also look at some characteristics of the participants as well during those venues. So that'll be part of what we put in when we try and summarize the study at the end.
I think that would be interesting. One random sample of one, a person in Cairo once said to me that, well, hookah bars are becoming much more popular among young teenagers because parents think it's a safe place for their teenagers to go and socialize. So they wouldn't let them go to bar, they wouldn't let them necessarily go to a restaurant, but for whatever reason, in his mind, hookah bars were considered a safe place for young people to go.
We have that information about the age of the customer. And I believe it was pretty, there was a quite diversity. Like some values will have more older people, some others have more younger people.
It depended a lot on the neighborhood, and I think we'll probably find income levels too. We asked age range, education range, where they come from, local neighborhood, tourists.
So the discussion up front for the recording was more getting into the detail of that we ask about the clientele. So we know something about their sex, their age range, and so we have some information about the socioeconomic status and the neighborhood characteristics as well that'll help us think about who these patrons are.
Well, Pat, thanks so much for sharing these innovative